The TubeClear Instructional Video. Patients who are unable to swallow due to conditions ranging from Alzheimer's disease to cancer to traumatic injury often require tubes for nutrition, medication, or decompression. Whether surgically or non-surgically placed, these tubes can become clogged. TubeClear works inside the feeding or decompression tube using a proprietary mechanical motion. When a clog is cleared by TubeClear, it eliminates the need to remove and replace the clogged tube. Designed, tested, and manufactured under an ISO-certified quality system, TubeClear allows healthcare practitioners to minimize time spent on hardware issues and maximize time spent caring for their patients. TubeClear has been developed in consultation with practicing healthcare practitioners. This video provides step-by-step instructions for the use and operation of TubeClear.
TubeClear is indicated for use only and solely in clearing occlusions, clogs, and feeding and decompression tubes in adult patients that have a tube of size 10 to 18 French.
TubeClear is intended for use by licensed healthcare practitioners. TubeClear consists of a reusable control box and a single-use clearing stem. There are different models of clearing stems for different feeding and decompression tubes. Please refer to the operator's manual for specific clearing stem models and corresponding indications for use.
Clearing stem models are designed to clear tubes of the indicated type and French size. The tube length determines the placement of the collar and prevents over-insertion.
The clearing stem consists of a long, flexible wire encased in a flexible sheath. The tip of the wire is rounded and very flexible. The control box contains a motor that activates the clearing stem. The motor causes the wire to move very quickly forward and backward inside the sheath. The backward and forward movement of the wire breaks up and clears clogs inside the feeding and decompression tube. Watching this video does not substitute for reading the entire operator's manual before using TubeClear. Disregarding the cautions and instructions presented in the operator's manual constitutes abnormal use.
Verify that you have the correct TubeClear clearing stem model for the type, size, and length of the patient's tube. Refer to the operator's manual or packaging for model selection. Place the control box on a level table or IV pole table to reduce the risk of the control box falling. Select the side of the patient's bed where you can easily access the tube ports. Position TubeClear within about 1/2 meter or 2 feet from the patient. Adjust the position of the table or pole to allow comfortable use of TubeClear. It's recommended that the operator wear eye protection and gloves when operating TubeClear. It's recommended that a disposable pad be placed on the patient's chest and stomach area during the use of TubeClear to keep the clearing stem from touching the patient or bedding. Verify that the power cord is securely plugged into the power supply. Plug the power cord into a standard 3-prong outlet. Plug the power supply cord into the jack on the control box, being sure to line up the pins. Verify that the control box is operational by turning the on-off power switch to the on position. The green indicator light will illuminate when the control box is operational. Note: the control box motor will not start at this time. The start-stop button needs to be pushed down before the control box motor will operate. If the yellow indicator light illuminates, do not use the control box. Cycle the power by turning the power switch off and then back on. If the yellow indicator light remains on, do not use the control box. For the return policy, refer to section 10.0 of the operator's manual. Remove the clearing stem from its packaging. Keep the packaging for later use. Anytime the clearing stem is not in the patient's tube, loosely coil it and place it into the packaging. Pull the red plastic cover from the magnet adapter at the end of the clearing stem. Likewise, pull the red wire tip cover from the other end of the clearing stem. Place the red magnet cover inside the packaging. The magnet cover will be needed later. Directly place the clearing stem magnet adapter to the center of the control box diaphragm. The magnet adapter will adhere magnetically to the center of the diaphragm. Pull gently on the magnet adapter to confirm that it's securely attached. There will be resistance if the magnet adapter is properly attached.
If the magnet adapter is not attached securely, reposition the magnet adapter onto the diaphragm center. Firmly clip the stem lock into the bracket adapter and verify the connection is secure. Proper placement of the stem lock is necessary for effective operation. Do not operate TubeClear if the stem lock is not securely clipped in the bracket adapter. You may loosely coil the clearing stem around your hand to help control the clearing stem length while inserting it into the patient's tube. Do not tightly coil the clearing stem around your hand before or during use because this will slow the wire motion inside the sheath and decrease efficiency. Equipment setup is now complete. Throughout the clearing process, insertion of water and/or aspiration of loosened clog contents using an enteral syringe may be helpful. If the use of water is permitted per doctor's orders, insert up to 30 milliliters of water at a time into the patient's tube. Hold the patient's tube in one hand and the clearing stem in your other hand. Insert the clearing stem into the patient's tube only a few centimeters at this time. Hold both the patient's tube and the clearing stem with one hand and press down the Start-Stop button with your other hand for 2 seconds. Note: the control box will automatically turn off after operating for 10 minutes. The control box may be restarted by pressing down the Start-Stop button again. Manually advance the clearing stem until you encounter resistance from the clog. Continue to apply gentle forward force to the clearing stem to break up the clog. Manual backward and forward movement of the clearing stem may be helpful in breaking up the clog. Do not apply excessive force to the clearing stem. Any sign of kinking due to the operator force will decrease effectiveness. Continue forward advancement of the clearing stem until the collar reaches the tube's external port. If this does not occur within 10 minutes, refer to section 12.0 in the troubleshooting guide. After the collar reaches the tube's external port, move the clearing stem backward approximately 10 centimeters or 4 inches, then forward until the collar reaches the tube's external port again several times. With the control box on, hold the tube with one hand and slowly remove the clearing stem from the patient's tube with the other hand. Reinsert the clearing stem until the collar reaches the tube's external ports at least 2 more times. This will help to clear any material that remains at the distal end of the patient's tube. Additional backward and forward movement may be necessary to clear clogged material. With the control box on, hold the tube with one hand and slowly remove the clearing stem from the patient's tube with the other hand. Stop the control box by pressing down the Start-Stop button. Do not detach the clearing stem from the control box at this time, as you may need to reinsert it if the tube is not yet clear. With the magnet adapter attached to the control box, loosely coil the clearing stem and place it back into the packaging during patency confirmation. Verify that the patient's tube is properly placed using your institution's protocol. Use the enteral syringe to aspirate or flush loosened clog contents out of the tube. Verify that the patient's tube is clear using your institution's protocol. If the patient's tube is still clogged, repeat use of TubeClear until the clog is removed. If this does not occur within 10 minutes or if progress is not made, refer to the troubleshooting guide. After verifying the patient's tube is clear, disconnect the clearing stem from the control box by unclipping the stem lock from the bracket adapter. Then gently pull upward on the magnet adapter to remove it from the diaphragm. Immediately replace the red plastic cover on the magnet adapter of the clearing stem prior to disposal. Do not dispose of the clearing stem with ordinary waste. Dispose of the clearing stem as regulated medical waste in accordance with applicable government regulations and your institution's protocol. If any of the declogged contents from the patient's tube come into contact with the patient or any surfaces, consider the declogged contents to be similar to vomitus. Clean the patient and surfaces in accordance with your institution's protocol. Consult the TubeClear Operator's Manual for further cautions and other supplementary information. TubeClear is intended to clear occlusions, clogs, and feeding and decompression tubes. TubeClear is intended for use by licensed healthcare practitioners. Only use TubeClear if you know for certain the type, size, and length of the feeding and decompression tube. The TubeClear clearing stem model is available for the type, size, and length of the feeding decompression tube. The feeding and decompression tube has not been removed from the patient. The feeding and decompression tube does not require placement or repositioning. The feeding and decompression tube has been in use for a period of time, less than or equal to the tube manufacturer's recommendation. Make certain that the correct clearing stem model has been selected for the type, size, and length of the feeding and decompression tube. Use of the wrong clearing stem model may result in overinsertion. Overinsertion of the TubeClear clearing stem may cause harm to the patient's stomach or intestines. Use of a clearing stem in a smaller French-sized tube than indicated may result in the clearing stem becoming lodged in the tube and possible tube dislocation when the clearing stem is removed. If the patient's tube is removed, do not clear and reinsert the same tube. TubeClear is intended to be used with the tube residing in the patient. If the tube has been removed from the patient, follow your institution's protocol for insertion of a new tube. TubeClear clearing stem NE models may cause some discomfort to the nasal passage during use. TubeClear contains magnets. Magnets are inside the control box and at the end of the clearing stem that attaches to the control box. Do not place the control box and the magnet at the end of the clearing stem within 15 centimeters or 6 inches of pacemakers, defibrillators, and other electronic devices, including but not limited to credit cards, videotapes, televisions, computer monitors, and other CRT displays, because the magnets may interfere with the operation of those devices. TubeClear is non-sterile. It's intended to be used with the feeding and decompression tubes and does not require sterile conditions for its intended purpose. Do not use TubeClear in any manner that would require sterile conditions. No modifications of this equipment is allowed.